to Together We Launch Resiliency podcasts. I'm here with Dr. Stephen Kanne, the director of the Center for Autism and the Developing Brain. He is the professor of psychology in clinical psychiatry at Weill Cornell Medical College at New York Presbyterian Hospital. He's also board certified in clinical neuropsychology. Thank you for joining us today. And I'm the social worker at Easter Seals in Westchester, New York. What aspects of the center parents seem to appreciate the most?
Our providers and the actual building itself is set up to create this sense of support and a village, basically, in this sense of it takes a village, for example, and that's kind of what our approach is, right?
That's nice because so they should definitely not be concerned that they're going to a hospital and their child's going to feel medically evaluated. That's
It
awesome.
doesn't feel like that at all. Yeah.
Great. There's a difference between educational eligibility and a medical diagnosis for autism. Can you explain that?
So we want to be really clear with parents, and we work with the schools in a big way to differentiate those two ideas. You could have a medical diagnosis of autism, meaning you can meet criteria for autism and not actually meet eligibility in the school. Because the school, it's not a diagnosis in the school, it's an eligibility criteria saying, do you have enough symptoms that require you to get supports in the school in our particular context? And sometimes you meet in one place and not the other, and vice versa. You can meet for autism in the school. It's rare, I'll be honest. Most of the time you get them in both, but it can be confusing because sometimes teachers don't see the full picture because we know the history, the developmental history, and they only see that child in a school setting.
Would you say that some of that is the lenses of a school or education system?
I think where people ran into some problems though is like, oh, well, this kid's getting straight A's, so they're okay. But you just rose a very good point in the fact that educational impact can also include social components, working in a group, being able to have problems with your peers or not. So what they've recognized, and schools are doing a much better job these days of recognizing that educational impact as well, and now including those kids in educational
Yes.
eligibility. So oftentimes when a parent brings a child to us, there's something going on. Meaning there's a reason why they came to us. It could be autism, it could be social anxiety, it could be a mood disorder, it could be ADHD, it could be a language disorder. I mean, there are a range of different possible explanations, or it could be nothing at all, right? So there's a range of different possibilities for why they're coming to us. Our job is to say, okay, let's see where your strengths and your weaknesses are, your challenges are. Does this fit into a diagnostic category? Great. And then how do we give you support from there?
Is there some underlying, we touched upon some of it, but is there any other underlying value system or internal methodology that could be factors, or is it the expertise of staff or something else that leads the center to produce the experiences that so many children and families find helpful? You mentioned the environment, you mentioned the incredible medical support. It sounds like your clinicians are very passionate about what they do and want to help the families.
We're very selective about who we want to work at our center. So it's not just, are you good? It's, are you the whole package?
What advice would you give parents just to help them find that courage to access the resources to reach out to a center or developmental pediatrician?
You know, as a parent, I think you have certain dreams and expectations for your child, regardless of what your child is or does. And anything threatening that is scary and creates anxiety. So one thing that we tell parents is when you bring your child to us, we're not changing your child at all. Your child still is who they are. What we're trying to do is help you understand your child better. And that might mean a diagnosis, that's just a label, but it could mean how can we help support them? I think the problem in our field, and I'm a victim of this too, is we're trained in a medical model.
Mm-hmm.
What I mean by that is we're trained to say, what's wrong? What are the deficits? How do I identify these deficits and diagnose you? And that creates this sense of what's wrong with your child, right? And that's what parents are afraid of. So one thing we're trying to switch a mindset to, and this is with the injection of neurodiversity and how we're trying to appreciate that, is that there is a recognition that there could be something wrong in impairments, but we also want to understand there are incredible strengths that are involved in whether it's a diagnosis of autism or something else. Oftentimes it's the fear of hearing it and confirming it, but it's also this sense of relief.
I like that. And I like the idea that it's about, character and traits of a person and how they might perceive the world and how they're going to interact with the world rather than the label. And
I read this study years ago that said 80% of the time that usually a mom thinks there's something wrong with their child, 80% of the time she's correct. So part of this is listen to the moms, listen to what they have to say. They are the experts in their own kids, So
and there's nothing, I'm guessing that there's nothing detrimental about coming to get an evaluation and maybe finding out that there's some environmental factors that are in play, and it's not a brain development issue, but instead something that we can manipulate the environment or make some changes. So for years of my work in the field, I've come to learn that finding the right specialist or the organization can make a significant difference in the approach and the information. Can you share with parents, for example, how a general pediatrician may differ from a developmental pediatrician in terms of training and perspective? And can you also express how that can lead parents to possibly receiving different information from the medical community?
Part of our best practice evaluation is considering medical factors that might affect how a person presents themselves. And our pediatrician has more expertise in autism and talks to us, who only do that. So it's a part of our team evaluation. Now, a developmental pediatrician has a whole different kind of training than a general pediatrician. So just as we are, they actually are training the development of a child behaviorally as well as the physical symptoms. So they might, have a longer evaluation that includes some tests having to do with motor skills and even cognitive skills. And then their expertise is being able to combine the behavioral aspect with the physical aspect, where a general pediatrician tends to focus more on physical symptoms, and that's where their expertise lies.
That makes a lot of sense because a lot of times I will have parents that their pediatricians don't pick up on it. I encourage parents who have the concerns if to try to get to the center, but if you can't get to the center, to definitely try to find a developmental pediatrician to check out.
Absolutely. If someone came to me and I'm not an expert in a very big diagnosis, let's say schizophrenia, I'm not going to give that diagnosis. I'm terrified, right? So I want to defer it to an expert. So I think that's what's happening with pediatricians. They're like, this is a big diagnosis in their mind, so they don't want to give it without sending it to an expert. And let's face it, most experts, it takes a long wait list to get into most of them. So that's part of the disconnect.
As you may know, parents may have mixed feelings about having their child evaluated by any person who sees their child briefly and makes a diagnosis or a judgment that can have long-lasting implications. And this is especially true as parents may consider that some of the behavioral health diagnoses have no easily visible known markers in the brain. And parents perceive, and the literature shows, that many developmental challenges can also lead children to be at high risk of stigma and social isolation. What can you share with parents to allow them to feel more comfortable with accessing resources like the Center for Autism and the Developing Brain, even knowing that these are the obstacles for parents?
What we try to do as our center is recognize that and say, wow, whether you're a child with autism, a parent, or an adult, we want to be able to provide supports for you. That's why it's super important actually to decrease the stigma, to be able to have an accurate picture of what's happening with that child. Because otherwise, if they are running into difficulties, people might assign the wrong reason to it that has equal to or more stigma. What I found is oftentimes, if you don't tell a child, for example, if you don't diagnose it accurately, the child knows there's something wrong.
Yes, it can really impact their self-esteem because they might act in a certain way because that's who they are, and they should not be, treated like they did something wrong.
Everyone perhaps can use some social coaching. Like, how do you do better to interview? Do you make eye contact? Do you say do you say please and thank you? All these social graces that we all have to learn, which are more difficult for our kids with autism. So that it might take a greater amount of help and coaching to get to that point. But on the flip side, if it doesn't really affect their functioning, why do we care? So who cares if they make noises? Who cares if they flap their hands? I don't.
Right.
But if they meet,
But by them being educated, the families and the children, then the child can learn to advocate for themselves and say, like, this is who I am.
but I think we as a society have to change too, in
Oh,
terms of our.
that's awesome. That's what this is all about. That is key. And we can. And it's about being able to get our human potential overall as a society for everybody. I mean, when you see a child who has a challenge, overcome it, and then you look at your life and maybe you don't have that challenge, you are forced to start saying, what can I do more and better, and reach out for your own strength.
What's the saying? When the tide comes in, all boats float. It's so true. And what you just said applies to any kid, whether they have autism or not, right? It's like my own children. I want to support them. I want to accept them. I want to adjust. The difference with autism is some of the difficulties that they have, the impairments they might experience, require more support.
From my years of experience as a school social worker and an agency social worker, I've had the honor of being part of numerous classrooms in several school districts. I've also provided services in many homes and completed a lot of research, especially when I was in the process of getting my doctorate in social work at USC. From my professional experiences, I have come to the conclusion that a child's self-awareness and a family's gainful understanding as the child develops can have a positive impact on the individual child. In fact, with the appropriate support, the family and the child's resiliency can increase and become protective factors against common challenges. A child who becomes aware enough to understand their own strengths and interests may grow and learn to advocate for themselves at meetings and different settings. What's your perspective or the center's perspective about this?
I agree totally. Diagnoses can be bad because they lump people into a certain category. People have biases and perspectives about a person with autism. But on the flip side, they can also be powerful because they put boundaries and understanding around what you might be experiencing. And like you said, give you a pathway for treatment and support that we can now help and build that resilience and build that self-esteem and have them self-advocate and have them understand context and how they can operate in our societies.
And the center is completely voluntary, or are people mandated to go there? I mean, do the parents and the children always have that option to what supports they want, or?
So one of our, yeah, so first of all, it's as a clinic, people get referred to us and they pay through insurance. So that's completely voluntary, obviously. On the treatment side, the same thing. So we make recommendations for treatment that you may or may not want to be a part of. But what we've instituted over the last year is more of a patient and social support network. So we have a social worker now and a patient navigator who actually helps connect our families to appropriate resources in the community if they want them.
Okay, so they're never forced.
No, gosh.
Okay, that's really important, and I would love parents to really hear that they hold the option card. So
Absolutely.
Coming to the center, getting an evaluation doesn't mean that they lose their rights or their choices.
This is confidential. They don't have to tell anyone. So,
Can they go to the center and get a diagnosis and not tell the school?
yes. So
Okay.
it's just like any other medical condition. You don't have to disclose that. That's your confidential health information.
And once in the medical world, once children are, or some in the medical psych world, once children are 13, they have a choice of who gets the information of their medical.
Yeah, it depends on the state, obviously, in terms of when you become an adult and emancipated and can actually give or not give your health information. We strongly encourage parents to disclose, both to the schools and to the child, for the very reasons we already talked about. By hiding it, it becomes a stigma.
One of the reasons that I have, together we launched Resiliency podcasts and the program, is because I worked with Willowbrook class clients. I had parents who never told the siblings that they even had a child with a developmental challenge because there was so much stigma. And then the parent passes on, and then the rest of the family finds out that they had this sibling. And it was just so sad that the parent had to live an entire life feeling that there was such stigma, like they just couldn't even, and the guilt they felt and all those feelings. And so this is one of the reasons that I think this is so important.
Yeah, I think we're I'm encouraged, and I agree. I've experienced the same thing, not just in the world of autism, but in the world of mental health in general. There's stigma around mental health issues, period, or cognitive delays, or intellectual disabilities, or autism, where put in institutions. And we often, as individuals, we live up to the expectations that are given us, right? So if you don't expect a whole lot and put them in an institution, oftentimes they have lifelong difficulties. But what we found in the literature, as you know, is if you do give them supports and do expect more, they can, like, who knows what the ceiling is for them. They can often do amazing things, right? Then I look at my daughter, who's graduated from college now, and listen to her talk, and my hope is there. I think society changes, culture changes. It's not as changing as fast as I would like, but there is so much. Like, listen to her talk about kids in her classroom and the diversity. It's so much different than my generation or my parents' generation. I
Much
mean,
more accepting. Much
yes.
more accepting.
And there's still prejudice, there's still stigma, but I think there's a trend. And then now when she becomes an older adult, hopefully that will continue and increase. So I have hope.
Oh, good. And I personally like the word. I think that the future we should call it brain health instead of mental health. And I think that would open up a whole window.
The whole Western mind body distinction that creates this difference. Well, let's just call it health. Why make even a distinction about brain? It's just health.
Can you share some of the pros and the cons parents have expressed as a result of accessing the services and the evaluations from the center or similar resources? And again, the pros and the cons.
Yeah. So I think, let me answer that in a different way, where I think what that assumes from people is this linear scale of severity. Like, how severe is my child's autism? Is it a 2 or is it a 10? And they think, oh, if I'm only a 2 and that person's a 10, then I have different needs. And I want to shift people's thinking about this linear scale. Autism itself is not a linear scale of severity. It's more like this circle of broad strengths and weaknesses of motor, cognitive, adaptive skills, social skills, that you might be strong here, weak here, strong here. So it's not linear. So the pro of coming in and being able to get an assessment is not to say, where are you on this linear scale, but to say, oh, give me this profile of strengths and challenges, so I know what strengths can I leverage and what challenges do I need to address. The bad thing about it, in terms of a con, is it really does challenge, I think, parents to be accepting of what their child is. So I think it challenges parents in many ways. And part of it is you're tapping into the parent's own hopes, dreams, and biases about their own child. And yet they're there at your center because they need help.
How do you take parents to the level where they can put aside their own fears and their own inner dialogue to get that?
No, that's a great question too, because I think, as technology increases, there are many, my own research, we're looking at how do we use technology to improve our diagnostic skills. I think some people would like an app. You walk into Walmart and you like look at the screen and says you have autism or not. What it's missing is what you just said, meaning part of my job when I work with a family and my clinicians, our assessment isn't just the child. Our assessment is like, okay, parents, where are you at? Where are you at in terms of your family functioning, in terms of your understanding, in terms of your needs? And how do I meet you where you're at? How do I educate? How do I support? How do I teach? How do I back off in a way that makes you as a parent understand your child better? Because for me, that helps the child. I think the biggest one to acknowledge it's a medical system, meaning it's a medical approach. So you will get a diagnosis. And oftentimes people focus in on the what's wrong. And it can be really challenging and in your face. Sometimes I work with families where I feel like we're ripping the curtain aside, the curtain aside, right? It's like, because the tests that we do really show where the challenges might be. So that can be incredibly threatening as a parent. It can be incredibly not hurtful, but just challenging. There's a grief process sometimes
Yeah,
that you.
that was what I was just thinking about when you were saying
Yeah.
that about that parents almost grieve the idea that
Yes.
they were going to have this
They
other
grieve the
child.
idea of their own, and they gotta, like, there's self-advocates talking about this too. Like, you're grieving your own projection of what you want your child to be, not what your child really is, right? So, and that's hard.
Yes, and I want to say there's so many people that have autism living a very productive, happy,
Oh my gosh, yeah.
healthy, incredible life.
Autism tends to be romanticized a lot, meaning like the TV programs, The Good Doctor. It's like, and I'll be honest, not every child has that level of skills. Not every child's going to be, Sheldon from Big Bang Theory. Autism isn't something you have; it's something you are. You if you have autism, meaning like if you are autistic, you might have a range of strengths and weaknesses that create needs and strengths and things you can leverage, but it's your identity. So it's different than like, oh, like let's cure it. You can't cure autism. It's something you are, right? What you can do is support the needs, but autism is part of their identity.
What would you say to decrease the impact of the fear and the stigma?
One is you have to acknowledge. For me, it's acknowledging where the parents are. Meaning, like it's just again, if it's grief, as you know, there are certain stages you have to support. There's acceptance. So what we do is just try to be as supportive as possible. Meet the family where they're at, know where they're at, acknowledge it, and then be as supportive as possible with where they're at. So.
I also have often seen where one parent accepts it and another parent does not, and then it creates marital drift. And what I try to do is actually work with the parent who more acknowledges it and try to tell them to try to give the other person more time to process and learn and see, because eventually it's going to become more evident to them.
Even more so with extended family, the grandpa, grandma who says, oh, it's not, they don't have autism. I don't see that. You're just a bad parent.
Would you say to a parent, maybe you want to get evaluated, or do you
Depends on what we see and what the parents report. Often it comes out during the interviews. Mom's like, oh yeah, it's just like him, so, or Uncle Joe had some social issues. Autism is one of the most heritable psychiatric disorders there are. It's highly heritable. It's strongly genetic. So we do acknowledge that, which, our recommendation is almost every family do get a genetic test done, because I think what we're acknowledging is autism is the behavioral phenotypic diagnosis. We assume that there's an underlying genetic cause for every autism that we see, but there's thousands of different autisms, right? Back 20 years ago, we were looking for that one gene that caused autism, and there's not. And that's why we're still trying to figure it out. It's also what they call epigenetics. So there are environmental factors that affect the presentation and the manifestation of genes.
That also then would lead to pharmacology possibilities.
What we want to do though is identify, what particular types of interventions, pharmacological or behavioral, support the challenges that people that are autistic have. And there are no like specific pharmacological interventions that address core autism symptoms. There are certain medications that are approved in autism to address specific behaviors. So ADHD behaviors, for example, mood disorder behaviors. Aggression is another one that, like Risperdal and some of the atypical antipsychotics, have been used to address those at low doses.
Parents are sometimes unaccepting of the possibility that their child may have a developmental challenge, or they may be scared, or they may wonder, what if my child receives that diagnosis of autism or another diagnosis? Can you share some of the benefits you or staff have observed in children and parents if the child does get the evaluation and does get the diagnosis at an early age?
Yeah, I think, all the evidence shows can always support and help. But that being said, the way I think about it is if you can identify autism early, if you can intervene early at a core pivotal skill, it's called, and help support that, then you can build on that in a big way where the trajectories of their support are different.
Dr. Temple Grandin, very famous person who has autism, shares some inspiring stories of achievement from adults with autism and attention deficit hyperactivity disorder. So I'd like to hear if you have any comments about some of the excerpts from the book. Something she said was, quote, "The mind of a person with autism can always keep learning. It is never too late to change. A person on the spectrum needs an employer, a spouse, or a friend who can calmly coach them when they make social mistakes." Yes. And do not, I would say across the board, do not let a diagnosis limit. Temple also referred to individuals with autism, quote, as, "It's imperative that these outstanding folks use their unique and special skills to help themselves and the rest of the world."
What I like about that is it creates a different, for us who are neurotypical folks, a different mindset for people with autism. I think, the theme that you're hearing from this podcast, we can celebrate, the strengths and the challenges that these kids have.
So it's reasonable to believe that coming to understand if a child has autism or a brain developmental challenge, the very thing that parents may initially shy away from, which is understanding or knowing, is actually the very thing that can increase the resiliency in the child and their family.
And I think that is one of the missions of our center, is how do we help the child and the family understand that. So.
Together We Launch Resiliency series will now take this opportunity to emphasize that the Together We Launch does not just rely on resiliency, but it also allows listeners to understand in podcasts like this one, it's important to consider leaning on the word together. From today's podcast, parents, families, and their individual children may be better able to understand the link between behavioral health systems of hospitals and the resources available through educational settings and schools. Perhaps this insight and understanding for parents may improve their ability to leverage this knowledge and find it insightful in considering options for their own child. On behalf of the families and the children that will benefit from your insight, we thank you.